Hi friends, she is Mrs. Seema Verma. She came to us before about 5 days with history of quadriplegia. Now, before 3 years also we had treated her for quadriplegia, and this time as we knew the diagnosis, it was hypokalemic periodic paralysis. So we corrected her potassium level and she has become normal. At the time of admission, her potassium was 1.3 milliequivalent per liter. So now it is around 4, so she is better. Now, hypokalemic periodic paralysis is one of the very rare diagnoses. Before 3 years, she presented to me in the ICU with quadriplegia. We were wondering what she has. We did her nerve conduction study, EMG, which was normal. Initially, we had diagnosed Guillain-Barré or infective polyneuropathy, but as nerve conduction studies were normal, it was ruled out. We did her CT scan, it was also normal. We did her porphyria levels, it was also normal. Then we did her electrolytes. So we chanced upon to see that her potassium was only 1.7 at that time. So we immediately started potassium correction and started improving. The primary diagnosis of hypokalemic periodic paralysis was done before 3 years. Now, why she developed hypokalemia so severe? So we did her ABG. ABG was also showing acidosis. So a condition in which a patient has severe hypokalemia with metabolic acidosis. So what is the condition? One of the very rare condition is renal tubular acidosis. So we further investigated. We did her ANA profile. On ANA profile, we found out that she is also suffering from Sjogren syndrome. So analyzing the whole case, your renal tubular acidosis type 1, type 2 and type 4, she falls in the category of type 1 renal tubular acidosis, due to which she has metabolic acidosis and hypokalemia, and she will have to lifelong take intermittently potassium and alkali, because this is a problem in the proximal renal tubule, in which the excretion of acid is hampered and excretion of potassium increases. So this is a genetic disorder in which there is a connective tissue disorder associated with this. So basically we have to symptomatically go on treating this patient as and when every monthly or 2 monthly we have to see the potassium levels, and if they are severely low we have to admit the patient for potassium correction. So this was a very interesting case of hypokalemic periodic paralysis which we have treated very successfully. कैसा लग रहा है आपको? अच्छा लग रहा है? अब ध्यान रखना, रेगुलर फॉलोअप में रहना. Dr. Havisha, what do you say? How it happy with the treatment?
Patient is satisfied with the treatment and under the guidance of Dr. Rashmi and Ms. Dr. Woman, the patient is being discharged today. The patient is diagnosed with paralysis, and treatment and electrolyte follow-up is regularly done. And thanks for visiting the GP.
Ashwin, what do you say?
Yes, sir. It is grateful for me to seeing this type of cases. It is the first case in my life. Before admission, she was giving me history about her weakness. She is unable to move her hand, legs, and completely lower limb weakness. But after admission, we are correcting her potassium level. After 10 to 12 hours, she is moving her hand, legs, and recovery phase. And also, sir says that it is a diagnosed case before 3 years. So, excellent case, and we are learning so much things. And now she is discharged today. We are also happy for her.
We are so delighted that she is better now. And it was in this hospital only the first time which we have diagnosed her to have this renal tubular acidosis type 1. Thank you so much.